This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Well, we're calling today's show the warm-up for the hottest day of the year. I mean, not that you need us to warm you up, but hopefully, like us, you're in air conditioning, all right? But it will be the hottest day of the year. Good to have you with us. As always, Health Watch, Sundays, 8 till 9, right here on Talk Radio 1210, WPHT. As you heard the man say, Dr. Molly Fantasia is here, the PhD doctor, and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. And, of course, Dr. Molly is here and ready to talk to you if you have a question for Dr. Molly, whether it be about a medical challenge or about anything that we're talking about, or in general, just a question about your health. 855-839-1210 is the number, 855-839-1210. Our show is Health Watch again every Sunday, 8 till 9. Talk Radio 1210, WPHT. Dr. Molly, thankfully, we're in air conditioning today.
We are for right now, but, you know, I urge everybody to get out before it gets too hot so that you can go for your walk and, you know, continue some little bit of exercise.
Yeah, you should still walk.
Yeah, you just have to stay hydrated, right?
Exactly.
Which is what we talk about.
Which is what. Yeah, let's talk about what we talk about, which is Innovative Medical Associates. And I was talking to somebody, and we were discussing, of course, the discussion of the year, which was COVID. And I was talking about, you know, my immune system, and I always felt like prior to a vaccine that because I had the vitamin C treatments that my immune system was in good shape, and that really helped. So talk about what you do and how it relates to that.
Well, one of the things I think we have to start with is we are a private primary care facility, meaning we actually have a primary care facilities license, same as you would get in urgent care and or from the hospital outpatient. So we focus in on your primary care, and in doing so, though, our philosophy is we want to do as much as we can for the individual to keep their own immune system tuned up, which is in keeping with what you asked. We want you to be okay, and what we believe in is using natural substances to augment any pharmaceuticals that you might be taking, or in addition to help you get off some of those pharmaceuticals.
Like I said, prior to the vaccine, I always felt like I was protected from the fact that the immune system was kept up because of the vitamin C treatments that I was getting.
We can't be cavalier, right? If you got the virus, of course, you've got to get in and be treated, because now, you know, what's interesting with the coronavirus right now is how many long haulers I'm treating. So, and by the way, even if you caught the virus, which several of our patients did, they didn't catch it from my facility, but somewhere, and they were long haulers in doing that, which means that they had various systems affected. They're doing pretty well by coming in and maintaining their immune system now once they're through the virus.
You practice hydration therapy, and people kind of know what it is, but a lot of times they're not sure. I know you go through this in an initial consultation, but can you explain hydration and what's in the hydration, which is what really is your forte and which is what you have done for years?
Right. Hydration therapy is the use of IV fluids, and in our case, we use as much of the natural substances that we can, vitamins, minerals, amino acids, homeopathics. So we use these to give an individual an individualized protocol depending on what we're trying to do. For example, since we talked a little bit about COVID, we have a pre-COVID recipe in order to help protect us from the COVID virus, which included vitamin C and zinc and several other things. And then we have a long hauler protocol that has just been developed that includes some things like beta glucan to maintain our immune system. So there's so many things that we deliver through the intravenous, through the hydration, in order to maintain people's own immune system and let the immune system go to work. An interesting thing about that is we're using something, I don't like to use a lot of product.
I know.
Right?
I know.
Because again, our focus is on the hydration as the delivery vehicle, but I am using a particular product that has something in it called transfer factor. And what is a transfer factor? I've gotten 4 or 5 individuals who come to me and say, but why do I need this? Well, I'll tell you why. Because the immune system can be taught. It can get information from outside, which includes, by the way, the hydration protocols. And it trains our own immune system to then react to the invader. So yes, that's one product that we're using in addition to the hydration, along with something like lactoferrin, which is also extracted for that very reason.
Transfer factor, is that what you called it?
Yeah, we called it transfer factor, but it's a combination that actually does start the immune system. It targets the immune system. It controls. It talks to it so that it then recognizes the invaders that are potentially invade the body. And in addition to that, through the hydration, we look and then really maximize the liver detox. So it's a little complex, but I want people to know it's a combination therapy. So we have one for prevention and also one, if you get it, for the long haulers.
Which is why when you talk about what do you do here, sometimes it's not so easy. Right? It's not so easy to explain.
That's the art of this. We know the science. Look, we could go through organic chemistry from now to next year. Most people would find it too boring to think about, and sometimes I don't blame them, especially when you think about the Krebs cycle, which is a cycle of the cell. I like to talk about the journey of the cell, and that's really the important thing. We need to get enough nutrition that we ourselves can help our own body fight off outside invaders and tune up certain systems in our body.
So it's not that simple, but what you do, but it's simple. Exactly. That's what I was just going to say. You come in and you explain it, but you just have a little faith that you're doing what you do, and it's certainly helping you.
You know what I like? The faith, I like to say, is in the pudding. It's one of the things you and I were talking about ahead of time. You are my patient as well as a good friend. And it's interesting because people now come in on Tuesdays because they know you're there, right? And they want to chat, not just about, let's face it, John, the people in our clinic want to chat about a lot of things, not just what's going on.
Right, exactly.
Yeah. And rightfully so, which is why we're on this wonderful station.
Yeah.
But it's very interesting because they want to hear from other people how they're doing.
Yes.
And that's really the key to this. The proof of the pudding is in the results for a particular patient.
All right, 855-839-1210 is our number here. Dr. Molly Fantasia, of course, Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. We're kind of doing what we call our overview of innovative medical, and still, to this day, people say, well, you go on Tuesday and Thursday. Well, what are they doing over there? And I just say vitamin C treatments.
Well, I'll tell you one thing, John, that we're not doing. We're certainly not taking any of the minds of our particular patients.
That's right. That's right.
They're pretty sharp folks. They come in, they're sharp. I want to believe that when they leave, they're sharper.
So when people come in to see you, and particularly in the initial consultation, then they say, okay, Dr. Molly, I'm going to go ahead with this. What can they expect? Can they expect like weekly, or in my case, twice a week?
Well,
can they expect weekly visits to your facility, and for how long?
Well,
in general,
here's the thing, John. I think it depends on what the patient is coming in to do. You know what I find? I find that most people have come to us after a bout of something, whether they've gotten a chronic condition, whether their arthritis is really rearing its ugly head, where it's been pain management kind of thing, that they just can't take it anymore, but they've had it for quite a bit of time. So in a situation like that, obviously somewhere between 10 and 15 weeks might be what we need of IV therapies in order to change the outcome. That's really not a lot. When you think about medication and possibly some other things like surgery and recovery. We're right in the game. In fact, we may be a little ahead of the game because you're going to start to feel relief from a particular challenge, like your arthritis challenges, inflammation, this kind of thing. You're going to feel relief. The idea is I want it to be more long-standing, not just an immediate relief, but the kind of thing where we actually effectuate the change and improve the quality of life.
All right, we're coming up on our first break of the morning. Our show is called Health Watch. You'll find us here every Sunday, 8 till 9 on Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, executive director, and founder of Innovative Medical Associates, Marlton, New Jersey. You have a question for Dr. Molly, you have a medical challenge you want to run by her, 855-839-1210 is the number. And as we always tell you, if you call early, you're guaranteed you're going to get in, and Dr. Molly can take some time to discuss your situation with you here on the show. 855-839-1210 is the number. With Dr. Molly Fantasia, I'm John DeMasi. We return more of today's show after these words. Back here on Health Watch, operators are standing by right now, as they always are during the show, at Innovative Medical Associates, and you can contact them at 856-489-0505, 856-489-0505. If you have any question, any particular thought you want to ask them, you're a little bashful to come on the radio, feel free to call them, and that's what they're there for, okay? And, of course, you want to set up the initial consultation with Dr. Molly. That's really where you get some good information, and that, of course, is complimentary. 856-489-0505, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Right now, our number here in the studio, if you have a question for Dr. Molly, 855-839-1210. Dr. Molly, you've talked about this quite often, and we want to talk about it again because it's kind of a cornerstone of what you do. It's chelation therapy. Chelation is what?
Chelation is a hydration therapy that is delivered IV, and we use a particular amino acid called EDTA. However, I want to preface that by saying there are many other chelators. Chelate means to claw out. And I would say chelation is the therapy that we really got our start with. And if people remember Homer, he was a great proponent
he was.
Of chelation therapy. Now, we use it for many conditions. In the very beginning, of course, it was for hyperlipidemia or high cholesterol, high triglycerides. But since then, there has been so much more data about what else this does. Of course, it improves blood flow 12%. It is a component of our men's health program. It's also a component of certain cardiac programs that we do, including cardiac nutrition. So there is a component of the EDTA and the chelator in that to open up the blood vessels. We also use it in addition to improve the nitric oxide in the body. Now, nitric oxide in and of itself is improved with things like vitamin C, vitamin E, glutathione, and L-arginine. So you can see that in our chelation, we are not just using the chelator, but we're also using vitamins and amino acids that improve cardiac function and actually cross over to things like ED, John. So chelation has been used universally by a lot of physicians and a lot of scientists for the cardiac health, which then translates into other health for the vascular system.
We should mention your founding medical director.
Oh, he was a great guy.
He was a great guy and a sharp guy. And I remember he used to come on the radio with us and say, it's like liquid plumber.
Yeah. Today, I tell you, today's colleagues would beat him up about that because it's not quite like liquid plumber, but it is the best way to describe this.
Right.
Because it's really a very sophisticated interaction of these substances with things that are lining up like the plaquing in in your vascular system. And you got to remember, we have a lot of veins and arteries in our body. I mean, millions of miles when you think about it. So improving the blood flow by 12% is a huge, huge thing, not just for men's health, but for cardiac health, which is a mainstay in our clinic. And again, I want to take the time to say that we don't say throw out your blood pressure pills. We don't say get rid of all your cardiac medication. But we do say that by using our cardiac health protocol and nutritional supplements for your heart health, we can certainly improve your outcome.
I was just going to ask you, you're still doing this because in the
Yes.
in the beginning when you first started, and you're now 24 years.
25.
25.
In
Wow.
October.
I lost a year. How about that?
No,
25
in October.
in practice. How about that? It was a lot of cardiac patients.
Mostly
and
cardiac.
And I remember several of them had bypasses.
Yes.
And were still experiencing problems, and you were able to help them with this.
We were. And I think that indeed, in fact, I have several who are back for maintenance still.
How about that?
20 years later. So, yes, the bottom line is chelation therapy is a great integrative therapy. And I want you to know, we have a wonderful relationship with a wonderful cardiologist who absolutely believes in nutritional medicine.
So it's important, and a lot of times you say, well, you work with and you have consulting physicians.
Of course I do.
They are like-minded physicians,
For the
basically.
most part.
Right.
Now, sometimes I run into one or two that aren't like-minded who might be at the top of their game. I believe you had one who was a kidney specialist.
Yes, that's
But
which you sent me to.
I did, because she was the best in the business for what you had in the moment.
Yes.
But it's interesting because you actually managed to resolve most of your kidney issues. And by the way, I want to say you really had a problem, most of your kidney issues, with utilization of our natural products, including a specific probiotic for the kidney function.
Yeah, and that's the other thing. You know, when people ask me, what are you going for? I mean, I can't list everything.
No, well,
because you've always said you have several challenges.
you do, John. But you know what? It hasn't impeded your quality
No,
of life.
no, it really
You're
hasn't.
still working.
That's right.
You're going on a trip, right?
Yes.
You're not staying home like a hermit, right? You
Right.
came out during COVID,
Yeah.
right?
Yeah.
I mean, even though it was limited,
Right.
but you did. And that's what we want for all our patients, regardless of the challenge that brings them into us. What we want them to have is a quality of life. That's what we give you. I can't say we cure your kidney disease. We don't cure cancer. We're not curing your cardiac condition, but we're fine-tuning you so that you can have a quality of life no matter what the challenge.
Let's talk about chelation in regards to other things. We've
Sure.
always focused on heart, but what other challenges do people
Well-
have that you've used chelation for?
Well, of course, the ED program, the men's health
Yes.
program, right now we're using it extensively. You need to have some of this because we have to improve the blood flow. Then we have to improve your production of nitric oxide, which opens up the vessels. And so that's one of the things. We use it to help with liver issues. We've used it to help with people who've had clotting problems, again, but very judiciously. We've used it for stroke victims.
So there's a variety of things
Yeah.
that you could use it for.
Right, but again, that's only one part of a particular protocol. So, yes, it can be used straight for cardiac and hyperlipidemia. But what I do is for cardiac patients, there's a cardiac nutritional piece for it. For people who have a problem with stroke, what we want to do is then give some amino acids that can work on the particular area of the brain that was affected by the stroke. If people have a liver issue, whether it be viral or whatever, we want to detox the liver and keep it moving. An interesting thing I use in the liver issues are Jerusalem artichoke. God's ingredients.
There you
know
go.
how I feel. Jerusalem artichokes. So, I mean, there are so many things that go into this. When I say just chelation, believe me, it's not chelation. And you can tell by how many various bags you see for particular people.
Yes. Well, I'm a two-bagger. I get 2 bags every
Well,
week.
at
So.
this point, because that's a lightweight.
Yes, right.
'Cause
I've
of
seen
where you
people
are.
with 4 and 5.
Yes,
Yeah.
yes. And again, I don't want people to think that we're overloading them with fluid, because we're not. we're very, very careful about how we deliver this.
How long can people expect to, let's say, chelation, whatever you're giving them in the bag? How long can they expect to come in to see you until they can kind of see or feel results?
I would say that they can get some immediate results in the first 5 treatments. However, it really takes between 20 and 30 treatments to effectuate change. So we're looking at about 15 weeks.
And that's kind of an average. Now,
That's kind of
maybe
an average.
maybe a little more,
Look,
maybe a little less.
look, we do a lot of cancer supportive patients who've seen me weekly, maybe 2 or 3 times a week for a fixed period of time, particularly when they're doing their chemotherapy, when they're doing their radiation therapy. Because again, I've got to keep the reserve to a level that maintains their quality of life while going through their conventional treatment.
Okay, we're coming up on our halfway point here of the show, which means you still have plenty of time to call in if you have a question for Dr. Molly, a medical challenge, anything in particular. 855-839-1210. It's a beautiful day in the neighborhood and a beautiful day to get healthy, right? 855-839-1210 is the number here in the studio. 855-839-1210. Like we always say, especially at this point in the show, if you call now, you're guaranteed you're going to get in, and we don't have to leave you and leave you hanging without taking your call. 855-839-1210. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, executive director, and founder of Innovative Medical Associates, Marlton, New Jersey. We are returning more of today's Health Watch after these words. Welcome back to Health Watch. As always, operators standing by at Innovative Medical Associates while we're here on the air. And, of course, they'll be there well after we leave you at 9 o'clock. So feel free to call them at 856-489-0505. That's the number for Innovative Medical Associates, Marlton, New Jersey. Also the number during the week if you want to call during regular business hours, 856-489-0505. And remember the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And we should always remind you that in case you miss some of the show or you listen but you want to hear it again, we have our Health Watch replay every Sunday 4 till 5 right here on Talk Radio 1210 WPHT. Right now we're live here in the studio on Health Watch, and the number 855-839-1210 if you have a question for Dr. Molly or a medical challenge that you want to run by her, 855-839-1210. I want to get back to Dr. Molly. You mentioned nitric oxide, and how it works. Does it work quickly?
Well, nitric oxide is quick acting in that it dissipates rather quickly, but it's a very important process because it dilates the vessels. And why do we want them dilated? Obviously for more blood flow. In fact, if you think about taking nitroglycerin, it's a method by which you have nitric oxide. So there are many things that contribute to that. Again, I'm going to say the vitamin C, the vitamin E, the polyphenols, glutathione, arginine, and various other things. In particular, where it concerns cardiac health, vascular health. So chelation aids that. So it's one of the things that we actually try to accomplish with chelation. And if you go actually on the web today, I've seen all of these ads for these oral nitric oxide kinds of products. Do they work? Probably in some cases, but again, nitric oxide is a nebulous kind of thing in that it's quick, it's a quick acting thing, it opens up the blood vessels. The idea is what you want to do is maintain the whole process so that you have your vessels open everywhere, including for the ED.
Can you say that when you talked about you can buy this like in the health food store? Is this the same theory that
No. They believe that oxygenation is part and parcel of this, and I do too. For example, if you've ever come into my clinic, you might see someone who's taking an IV and getting some O2, right? that's a way by which we can promote some of this nitric oxide and open up the vessels. So, there's an art to this, and I'm lucky enough to have wonderful medical directors who understand this and allow us to practice in a way to help people through this.
You often talked about the many benefits of olive oil.
Oh, my God,
Can you talk about that and
Yeah.
polyphenols and how
the
this all works?
polyphenols, listen, everybody, just take olive oil as much as you can. And actually, Dr. Molly, and again, this is another product that we have in. Right now, I've had about 3 products in-house that I'm really, really telling people to read about and push. We have a Moroccan olive oil. And, listen, I'm Italian. You're Italian,
Exactly,
John. We
yeah.
use olive oil
That's
all
right.
the time in everything.
That's a staple
But
in the household.
This particular olive oil has 30 times what is out there normally. And so I'm using it in a medicinal sense as an augmentation to people's vitamin regime. So it's a good thing.
So it's
antioxidants.
It's used for
everything.
Every kind of challenge. Oh, okay.
Autoimmune in particular. I'm using it with our autoimmune patients and it seems to be doing very well along with our autoimmune protocol for particular things. In fact, yesterday I spoke to one of my patients Lana, I can use her name because she's called here many times.
Yes.
And I actually wanted to tell her that I think I'm going to give her a bottle of this when they come in next week for both her and her husband, because I think they have so much in the way of joint issues and arthritic issues, although she admitted that she got some relief just from what we're doing right now. So that's really the key. The key is utilizing proper oral products along with the hydration.
And again, you give advice as to
Oh,
what
my
to
goodness.
get right.
Listen, come on in. Barbara will sit with you for an hour and tell you everything to go. And again, we don't have that much in stock, but what we do have is very specific, and it's specifically for patients for particular problems. And Barbara, though, on the other hand, knows every good brand. Now, look, somebody came in to me this is so interesting. The gentleman came in this week he came in from North Carolina. He has a house there, but he listens to us. And he brought a whole bunch of nutraceuticals in. I took several of them off and said, listen, would you just go to get this particular one? And Barbara said, if he comes back, she will sit with him, go through each and everything, and help him get through this problem. He's a nice guy, and he's having some traditional aches and pains. And, listen, as we get a little older, we get these problems, but they can be resolved through hydration.
Barbara gives you a list, by the way.
I
She
know.
typed up a list for me.
I know that. What she expects you to do is get them.
Exactly,
And
yeah.
again, I'm not selling them. So it's an interesting process here. We're all about tuning up your immune system. Look, it's the harmony of wellness. That's what I talk about when you come in. I want to talk about the harmony of wellness. People know it as mind, body, spirit. But what does that really mean? It means that we have to treat a patient in a holistic manner, meaning, yes, you may have joint problems, but joint problems are related to inflammation. And inflammation, as I say, can be good, can be bad. We got to get back to the Goldilocks theory. So when we look at someone, we're looking at the harmony of all of the systems. And that's extremely important, John.
And when you do that, you take into consideration not only your hydration therapy,
but others.
but other things,
like
right?
diet.
Right.
I mean, look, you and I both know we're not going to cure any cardiac issues if you don't change your lifestyle. But we also don't have to suffer from the same type of cardiac problems that, let's say, our parents had or our genes told us we're going to have, because we all know that there's an epigenetics piece of this, lifestyle, how we live, how much stress are we under, all of those things. And when you come in to see us, believe it or not, we like to talk about this stuff. And when you sit in our chair, you are getting the hydration, which can effectuate the change and give you some quality of life. But you're also getting a whole lot of knowledge, not just from your caregivers, but from other people in the chairs.
No sense in coming in and getting the hydration if you're not going to make the other changes, because it's
Right.
kind of like not doing you any good, right?
Well, it will do you some good, But ultimately, actually, what's interesting is after people start to sit in the chair for a while, they want to do the changes.
Right.
And you may never have had the impetus to do it before, but something happens, something clicks, and you start to realize, I do feel better. Now it's a question of maintaining that quality of life.
When you talk about the harmony of wellness, you said mind, body, and spirit.
Right.
Sometimes that's a little vague and hard to understand.
It is. Nobody knows what that means. It's like, okay, it sounds a little woo-woo, but when you come into us, what we try to do is make it less woo-woo, more scientific, in that we're going to look at you from brain to bone. So we're looking at everything that makes up your body. For example, it's important when you fill out our paperwork. Are you under stress? What kind of job? Most of my patients are entrepreneurial, whether they're highly educated executives or small business guys that own their business. There's a lot of stress there, right?
Sure.
You know that yourself, right?
Yeah.
Okay? There's a lot of stress. Lots of them can't eat home-cooked meals. They're out on the road. They do this. All of those things have to come into the play. But the cornerstone of what we do is the hydration therapy, because that'll give you the jump start to do the rest.
And you do that because that's the way you can effectuate change most quickly, right?
Quickly. And then we can work on some other things. Look, we believe in physical therapy. If you have some pain, you obviously need some physical therapy, which is movement. That's part of the mind-body wellness, right?
And,
the harmony of wellness.
Yeah. And I've been getting the physical therapy, and it's really been very helpful, yes.
So it's not just one particular thing, but the hydration is the cornerstone. It spearheads everything, even diet. For example, there's a whole symphony of hormones that we look at. Well, how do you change some of that? Well, first we have to make sure it's not a particular medical problem, and that's where my docs come in. They'll diagnose it. Suppose you need thyroid medication. Well, they can order it. But then what we want to do is tone you up, and I mean tone you up in terms of what's going on with your muscle mass, what's going on. Can we help you improve your quality of life? Hydration will help you do that.
Coming up on our final break of the morning, which means you still have time to jump in with a question or comment for Dr. Molly, 855-839-1210. Health Watch is our show every Sunday, 8 till 9, here on Talk Radio 1210, WPHT. Again, that number, 855-839-1210. With Dr. Molly Fantasia, the PhD doctor, the executive director, and founder of Innovative Medical Associates. I'm John DeMasi. We return with more of today's Health Watch after these words. Welcome back to Health Watch. As always, operators standing by at Innovative Medical Associates, and they are working today because 9 o'clock we leave you, but they're there, all right? 856-489-0505, 856-489-0505, Innovative Medical Associates, Marlton, New Jersey, and also their website, innovativemedicalassociates.com, innovativemedicalassociates.com. And we should also mention that if you missed any of our show this morning, or you want to hear it again, sure. We have our Health Watch replay, 4 until 5 every Sunday afternoon, right here on Talk Radio 1210 WPHT. Our show is Health Watch every Sunday, the live version, 8 until 9. We're going to go to the phones. Gina in Doylestown. Gina, good morning.
Hi,
You're
Gina.
on with Dr. Molly.
Hi, Gina. How are you?
Good morning, guys. I'm well, thank you. How are you?
Good.
So I have a question. I'm 55 years old. I'm overall healthy. I'm on no medications. I actually lost 27 pounds during the pandemic last year.
God bless you.
I did. I turned it negative into a positive.
Good
but
woman.
Thank you. My concern is my father dealt with cardiac issues his whole entire life. He passed away 3 years ago at the age of 78. He wasn't supposed to see the age of 30, so he had a good life, to say the least.
God bless him.
I have 3 siblings. All of us have the high cholesterol, but we have our triglycerides are amazing. I have never been on a statin, and I don't want to go on a statin.
Good.
So so if I were to come to you and have a consult, so you do a panel of the blood work, I'm assuming, right from the get-go?
You bet. You bet.
Okay.
And we might even do a very specialized blood work for you. Not only looking at cholesterol and triglycerides, but breaking those down. As you know, there are proteins that make up these lipids. And sometimes, and there's been a lot of data to support something called lipoprotein A that is responsible for some cardiac conditions. And there are many, many things we can do to help support you. But you are the prime patient that I know has taken their historical data, meaning from your family, right, your genetic data, and have changed it up by changing what? The epigenetics. You lost the weight. You watch how you eat, I'm sure, right, Gina? I'm sure,
yes.
right?
Right.
Yes.
My diet, my exercise.
Yeah, that a girl. Now, you must be taking some nutraceuticals, too. Are you?
Well, believe it or not, I'm taking a multi-women's vitamin,
Right.
and I
Good.
take a vitamin D. And
That's it.
That's all. I do feel like I eat very well. My father
Good.
was in the restaurant industry. We
Good.
grew our own. We did. We grew our own vegetables, so I'm continuing that on my my own home, my own garden. But
Good.
but I still have the genetics, right? I mean,
Oh, yeah, you
genetics.
have the genetics, but we don't have to let those express, okay? I mean, I
Exactly.
absolutely agree with you. So there is definitely, you're on the right track. I think we could tune you up just a little bit. You don't need to be a long hauler, so to speak, but you might find this very interesting. Would we use chelation? I might use just cardiac nutrition for a person like you. And by that, I mean using a specific type nutraceuticals that would improve your cardiac function overall. This is a great call, Gina. You're the kind of patient we love to see.
I was
God
just going to
bless
say,
you.
she's the perfect profile of a patient for you.
Yeah.
Perfect
yeah.
profile.
And I have other people in the chair, Gina, who are like you, honestly. And I'll tell you, you really looked at the genetic profile and knew you weren't going to have this problem. So God bless you. Continue your healing journey, my dear. You're a smart lady. She's a woman who understands the harmony of wellness.
Yes.
Thank you, Gina.
Gina, thanks for the call. We appreciate
Great call.
it.
Great call.
Do we have another call, Jim? Oh, okay.
Okay.
All right. 855-839-1210. Like I said, she's the perfect profile of a patient.
Wow. She's the kind. It would be interesting to run a bunch of other tests. And you know what else would be interesting? It would be interesting to run her nutritional panel because she's taking a multivite, she's eating well. It would see if we could optimize that by what we would put in the bag. In other words, if she were a little low, there's relationships between all of the nutraceuticals. The idea is move her even into a more optimal relationship. It's a great call.
And interesting, Dr. Molly, because as we talked about it last week, the number one problem for women, the number one killer is heart.
Right.
And she's got it in her family, so
all right.
smart looking
Smart.
into this and trying to be proactive
Rather
before
than
it's too late.
reactive.
Right, exactly.
Exactly,
okay.
John.
All right, couple minutes left of the show. I know you wanted to talk about, you have a patient with Lyme. We've always talked about Lyme.
Young man, and we all know that Lyme disease is running rapid here in New Jersey and PA. We know that. So this young man had Lyme disease, I think, back about 2 years ago. He's an interesting case because we think about long haulers only for COVID. He's a long hauler from Lyme. He has all of the side effects of the post-Lyme, and there are many for him. Joint pain, brain fog, fatigue. He said the fatigue is just unbelievable, and he's young. So he just started with me. I think he's on treatment number 4. His situation is such, by the way, he's still testing positive, okay, for the Lyme and the Lyme titer, which is unusual. Generally, once they do the course of antibiotic, they're not testing positive. But in his case, he's testing positive. So again, he probably is going, and he's on an additional set of antibiotics plus our post-Lyme protocol in order to hold down the side effects of the Lyme disease itself. That tick leaves a whole indelible kind of cascading of problems for patients who have it.
You've often talked about the post-Lyme is worse than
terrible.
the Lyme.
It's terrible. It's terrible. And you get a young guy like him, he needs to work, and he can't work full-time. I mean, it's just a mess. He was smart enough to look it up, and he said his traditional doctor said, listen, we cured the Lyme. You're just having a little reaction. I don't believe in that such a thing. You tell a guy who's young, supposed to be young and vital, that he's having a little reaction. No, heck no. He's got the long haul from the Lyme disease. The Lyme itself delivered bacterium and viruses to him that are comorbidities to this problem.
And with that, we are going to put the wraps. Sorry. Well, we'll pick this up next week.
Good. Thanks, John.
That's going to put the wraps on another edition of Health Watch. Don't forget, operators are there well after we leave you at 9 o'clock at Innovative Medical, 856-489-0505, 856-489-0505. And you can always check us out on the web, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, you want to hear the show again? You missed some of it? We have our Health Watch replay this afternoon, 4 till 5, right here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, Joanne, fabulous Fran, delightful Dee, and our nurses, Jess and Crystal, and our medical assistant, Chatty Cathy, I'm your host, John DeMasi. Thanks for listening. Have yourself a good day and a good week and a safe and a healthy one. We'll do it all over again next Sunday. Health Watch, 8 till 9, Talk Radio 1210, WPHT. You take care.